emotion, one of the toughest emotions that people go through. And I think it's important that we speak about it from the expert point of view. Today, we are delighted to have Professor Maria, who's from Department of Clinical Psychology and College of Medicine and Health Sciences. I just want to give you two notes, very important notes. For all students who are participating or attending today, please make sure that you fill up the registration form through the link that we will send you in the chat box if you want to get a certificate for today's session. For all UAEU staff members, if you want to count those hours into your training hours, also make sure to fill in the form that we will send the link through the chat box. And make sure that you evaluate today's session, because with the evaluation, you will guys give us a clear vision on what topics you want us to cover and how well did we do. Without having your feedback, we will never be able to improve ourselves in the future. So Professor Maria, I think we're delighted to have you again. Thank you for having us. I mean, thank you for accepting the invitation in today's session and to talk about such an important topic. The floor is yours, Professor.
Thanks a lot. I know, as I was telling you in the preamble, it's always a pleasure, a delight to work with the Happiness Research Center. You guys are really happy, even with topics with such emotional implication, your health, your disposition, and even your leadership, because if we see how many people we are in the summer, we have more than 36 people in the audience, in the room. So thanks a lot. So let's start. G is the name of a person. And she says, I'm hugging my dad and I whisper in his ear, if you come back, I will heal and I will be happy. Hold on, because I'm trying to go to the next slide. This is a dream of a person, a real dream. Let's work with this dream. If this were your dream, how would you feel? How would you think? How would you see? What metaphors you see in this dream? What symbols do you see in this dream? I only will tell you, this is the dream of a lady, a female person who lost her dad. So I would like to ask you, you can write it in the chat, to appropriate of this dream and think if this were your dream. Do not interpret the dream of this person. If this were your dream, what would you feel, think, what ideas comes to mind? You can write it and I will be reading here whatever you write. So let's do it right now. You don't need to write your name, just the feeling, the emotions, the metaphors, the symbols, whatever comes to you. I feel there is loneliness, feel sad. What else? I would not regret losing my dad. What else? Will determine to come back. What else? Missing him. What else? I feel like crying now. Developing the feeling of apathy. Apathy or empathy? Apathy, it seems apathy. Crushed. I think I feel so sad and it will be hard to get over. What else? Can't believe he's gone and I can see him again. So thanks. Thanks for sharing those feelings. This is the dream of a real person. She lost her dad due to the COVID pandemic. The fact is that this dream was recently. Her dad passed away 2 years ago. He was a senior person. He was not sick at all, so her death was not expected, even though as we mature, we know that unconsciously we prepare for the death of our parents, of our loved ones, but still this dad was full of love, full of energy. He was still working. So we will come back to this lady, to this dream. And if you want, we will continue seeing what other dreams this lady comes to our discussion. Okay. Let me advance. So this lady had a loss, and a change is lost. Lost must be mourned. This is a statement made by Harry Livingston in 1955, many years ago, but still it's very updated. It's very clear. When we lost a person we love, not only a relative one, but could be a leader of the nation, like the mourning that UAE is experiencing this month. We could experience different emotions, different reactions, very personal relationship with the person who is lost, who is dead, who passed away. We will see in this conversation that we will experience different emotions. So as we know, the country is grieving. We have 40 days of mourning, to grieve, to conciliate with the leader, with this very important leader who was the son of the founder of the country. So our objectives, let's come back a little bit to the logic and to the academic component of this workshop. Thanks to the Emirates Center for Happiness Research for thinking and for being so connected to these emotions that all of us experience when we are in a grieving process. So some of the objectives of today's talk, today's workshop, of course, identify grief as a normal process of loss, appreciate the importance of attachment. This concept is very important when we are dealing with grief. We will describe a little bit the process of grieving according to research. I mean, there are many research on grief. We will go to the classic, to the first one. And also, and also very important to discuss some strategies, some coping strategies, what we can do, what we do, or what I do, because we will see that grieving is also a very personal, very subjective. It needs to be in that way, because it's the way that we construct our grieving process. Hold on, I'm still trying to find how to advance. Okay, from the psychodynamic point of view, as you know, many of you know, my training has been essentially in the psychodynamic tradition. So grief, it's seen as a multifaceted process, and it could be influenced by essentially 4 components. Could be more, but essentially 4. The first one is the big one, okay, which is in the base of the pyramidamic process, how we as society, as culture, our ethnicity, our country, how social constructions are made of death, and loss. It's not the same now, for instance, that 200 years ago, in which people did not have the physical, the health resources that we have now, the social media influences, the cohesion of a society can have. So the social construction is very, very important in the way that we define grief and death. The meaning that for each either society or each person has this loss, the person's coping strategies, the way that we deal, what we do in order to accommodate, in order to continue life, in order to tolerate the pain that this situation can harbor. And also, I'm sorry, and also very important, the nature of the loss. It's not the same to lose, for instance, our beloved, our parents, if we were close to them, than a person that we were not so close to them. So the meaning that we are going to attribute to that loss, it's very, very important. Loss happens when something important, and that's very important to highlight, when something important to the person ceases to exist. So loss also could be a divorce, could be a job, could be the health, okay? Not necessarily another person, but of course, when we lose somebody who we are attached, it sometimes could be devastating. Bereavement is the grief exhibited when somebody mourns, when somebody is feeling, processing this loss due to death. Important to remark, and this is the arrow that you see here, it's like it's not a fixed process, but there's 3 sentences that I want to remark. The loss of a loved one, it's a universal experience. I mean, I can bet you that it's almost impossible to say that you have never lost something or somebody or some important attachment. We call in the psychodynamic tradition some important object, not because object, not in a fixed way, but the way that we internalize, that we in our mind deal with that person or with that important representation. So every person will experience loss and traumatic circumstances at some point in their lives, because loss is also related to a traumatic situation, because some of us miss these things that we have lost. Some of us, we are attached to that thing, and we are destructive. We are broken. We are break. Broken heart. It's the song, the name of the song, when we lose somebody. So this experience has the potential to displace a person from the anticipated life course, like the example that we started with this in this workshop with G, this lady that we will be talking about. So it's very important to comment that grief is not a linear process. Here you see 2 pictures. One picture, it's an escalator that it has like a brake, okay? So you escalate. So when you are grieving, it seems that you are escalating into the process. But also you see the other picture, a house being constructed. That means that through all our life, we are always constructing our grieving processes. Of course, attachment has been lost when we lose somebody, when we have lost a person that we are really attached. Mourning happens as a detachment from that loved one. The death of a loved one can result in individual losing her or his sense of self. And that's what happened a little bit with this woman that we are going to know through her dreams in today's workshop. Her name is G. Mourning is viewed as a task that we have to rebuild our inner world by, by experiencing what is in our inner in our inner life, okay? And also in our interpersonal life, very important. So the Bevert is the letting go of multiple attachments that are involved in the formation of this relationship that we have with this thing, with this object, with this construction, or with this person that is not life anymore. So when we accept, then we accommodate, and then we start to construct a new identity. We start when we grieve and when we resolve, in quotations, because we never resolve completely our grief, our losses, never. But we could form new attachments. We could form new ideals. If we lost a job, maybe we can find a better job. If we got a divorce, maybe we will stay again single, or we can regain again and form a new relationship. We don't know. But the important thing is that we get new attachments in order to regain ourself and our integration as a person. So grief is the condition, again, that we will experience. This can also apply, as I told you, to the loss of a leader, a fatherland, freedom, for instance, very important, freedom, or an ideal also. So it is when these affectional, look at this word, affectional attachments are broken or are lost, that the individual experience distress and emotional disturbances such as anxiety, crying, anger, feeling apathy, feeling that you don't want to leave, you don't want to go out of your bed. Sometimes language disappears. I was, for preparing this workshop, I was watching some videos of public figures that have lost their relatives. And in Spain, in my country, there is a very beloved presenter. Her name is Ana Obregón, and she lost her only son. Very sad, very sad history. She lost her only son. He was 27 years old, and he died of a cancer, a very aggressive cancer, just divorced. So he was, and I'm talking and I really get emotional when I remember her video. And she was so attached to his son. And the son, I mean, he was a very important figure in Spain because, he was handsome. He was an entrepreneur. He spoke several languages. And even both of her dads, her mom, which is a public figure, and also his dad, also it's a presenter in Spain. So everybody knew the family. And Anna said something that it broke my heart. She said, there were some days that, and I'm sorry if I get so emotional, there were some days that I cannot wake up from my bed, and even I cannot speak. I cannot use language of the pain that I was suffering. So these emotions are often expressed as mourning. You can identify many others that you have felt, that you have experienced when you have lost somebody, right? And this is not pathological. This is very, very important. And people usually, they don't need treatment. They need time. When we are grieving, we don't need therapy unless it's pathological, unless we cannot function properly. But grieving, it's a very normal, and we have to go through that. We have to allow ourselves to experience that pain in order to continue our life. After this interview that Anna gave on TV, she then accepted to be the presenter of the New Year's Eve. It's a very important night in Spain. Everybody watched TV to see the 12, ringings, waiting for the new year. So that's her way of grieving, expressing, even crying in front of the camera without shame, accepting that she could not even use words. Can you imagine that you cannot speak because the pain, the broke was so hard in her heart. So it's important to be connected to that and not be that as a pathological. Grief passes after some time, and that's important also to be aware. That's a coping strategy that we can use, that in a way, even though we believe that there is no hope, there is hope, because humanity, even though it's full of pain, is also full of joy, and there is always hope, even in the most difficult and painful situation. And the process, very important to consider that the process is not necessarily pathological. Okay, so we should trust ourselves, and we should trust our social networks. And also it's very important what we trust. This is something that is very personal, that people will tell you, oh, you have to do this, you have to go to the funeral, you have to talk about the lost person, you have to elaborate your grief, but still it's something that we have to do it. It needs to be from our internal subjective resources. It doesn't, we cannot resolve grief by coming to a workshop. I mean, it's important, because it's important that we connect and that we are aware. And the more we speak about this, the more we are going to be prepared. But still, we have to know that we will never be prepared to the losses that we are going to have in life. Numbing is a characteristic of these feelings of disbelief that the death has occurred. So at the beginning, it's impossible to accept. That's a natural reaction that even our brain has. And this provide the person grieving a temporary relief. When you don't feel, you're numb, you don't understand, you cannot even feel the pain that has been there for you. Okay, and usually it's short. This numbing situation is very short, and then it's followed by emotional outputs, emotional peaks. Okay, very then you become very active, you want to resolve the things with the person, that the continuation of life, and also with moment of being apathy, like some of the emotions that you comment on this dream that I showed, I shared with you. Then yearning and sharing involves the realization that the loss, when the numbness begins to fade away. Also anger, very important to be aware that anger and frustration is common as the individual, as the grieving individual is searching for someone to place the blame on. So sometimes we need to blame the other, okay? For instance, in the death of accidents, usually the victims, they felt so, the pain is so intense that they tend to blame either the deceased person or the person who in fact had some responsibility. So the blaming is so intense, the need for revenge. Sometimes it's part of this grieving process. The disorganization involves accepting the reality. I mean, it hopes. In the grieving process, there is also hope, because at the end, we human beings, we are accepting animals. And we accept the reality of the loss along with all the turmoil that it brings. So the evaluation of the self without the disease often occurs in this phase. And then there is a reorganization in which very little, very slowly, okay, we come to the realization that life needs to go on, that we need to move, that maybe we will form new attachments, or we will accept. And very little by little, maybe without us being aware, we start to change and to create new ways to connect with others, and of course with life. So now let's be a little bit theoretical, okay? Because if we stay only on the emotional aspect, then we cannot move. So in order to understand our emotions, it's important that we connect to what has been doing, what research can inform us. And I decided to start with the basic. There are many research on the grieving process. and maybe the first female, actually. It's very interesting that she was a female from Switzerland. She was a psychiatrist, Elizabeth Klober-Ross. She started studying people who were dying of cancer. And she created a model. She then migrated to the United States, and she was offered to a teaching position in the University of Chicago. Elizabeth Kluber-Ross was named one of the 100 most influential females in the history of research. Very, very important women that we should be aware of her existence. Even though some of her research now it's not completely updated, because researchers have found that her model, it's very important, but it's not enough. Her model, it's like a template, but researchers have now added more information, more inputs in order to understand the grieving process. This sentence made by her, this statement, we will come back, okay? So I will not read it. If you want, you can read it right now, but we will come back and we will use this statement that she made some years ago. She passed away in 2004, I think. And she was a very, very influential researcher and very influential woman. So she believes, Dr. Elizabeth believes that we have 5 identifying stages when we are grieving. Again, this is not linear, so we can move from one stage to the other and come back. So the first one is denial. We do not accept that the person has passed away. So it could be conscious or unconscious. So it's the refusal to accept the fact, the information, the reality. We do not accept it. Even though we know it's true, in our internal sense, we do not accept that. It also could be denial, as many, I see many students are today here in this talking. You know that we psychologists, we use this word defense mechanisms in order to understand how we defend from us being aware of things, okay? From us of being aware, or how we defend from anxiety. So it's a defense mechanism, but it's completely normal. Okay, overall, if in the beginning phases or stages of the process. So it is easy for people to become stuck at this stage when dealing with traumatic events as is the loss of a loved one, okay? Anger is the second stage. Anger could be towards ourselves, but also could be towards others, and also could be anger toward the deceased person. Why you leave me in this particular moment when I most needed you? Why you dismiss me from my job when I was enjoying so much my job, when I needed so much? A leader who passed away, why you left us as society when we need your guidance, your words, even your image, to unite us as a country, for instance, okay? So anger, it's a normal process and it's very uncomfortable, but also it's part of the process. Then the third stage is the bargaining, okay? With whatever God the person believes, inshallah, God, Buddha, why God you allow us? So we ask our transcendental images, our transcendental figures, okay? Why? Give me, sometimes we pray and we say, please give me the fortitude, the strength to continue. That's bargaining, because we want something in order for us to continue living, okay? And it's a solution, because at the end, bargain, it's also giving us hope that if you give me something, I will do that. So that's hope. Then depression. It's necessary. It's the sad part. You can call it sad, you can call it depression, in which sadness, regret, uncertainty, but it's more aware. You are now more aware of the feelings that you are experiencing. And then it comes the arrow, okay, acceptance. Symbolizes the emotional detachment of that figure, of that thing that you lost, and some objectivity, some distance in order to reflect. We call it in our psychological language, to mentalize, okay, to think about that person that has gone. So we come to terms with the loss. We never, again, sometimes we never, because when attachments could change, but once we are really attached to something, it's very difficult, but we make an effort to move on. So this, again, these are many in the work of Elizabeth Kluber. There are many articles, models that were taken from her original model. So this is a model that it's a little bit more specific: shock, denial, frustration, depression, experiment, decision, integration. So different words that, and always there is a curve. If you can see here, the depression, in which you go down, you bottle. That's how we say now, we touch grounds, we touch the bottom. Sometimes in Spanish, we say we touch the mood, okay, in order to, again, regain some skills, some coping strategies in order to continue our life. And of course, in order to grieve, we have to have a creative alignment. We have to maximize communication. Yes, we have to speak about what's going on inside of us. Of course, we have to have some type of motivation to continue living, develop the capacity to have new attachments, and also to share our knowledge. How did I manage that? What coping strategies I use? Okay, what I did that it worked for me. I don't know for others, but for me, this worked. And this is very important. So this is again the model. Okay, if you want, I can send you this presentation. It's, I mean, if you write in internet, you will find very easy her model, because again, it's very used, and it has been intensively researched, and it has been validated in several cultures, So as a country here, the UAE, you know that we are grieving in the sense that the country lost a very important figure, a very important leader, a very important governor, even though he was not so present in the recent years because of his illness. He had an HCV. He was the oldest son of the founder of the nation, so that has a special symbol, special meaning. The government announced for day of mourning, okay, and also the symbols. If you can see, the flag is not fully raised; it's in the middle as a symbol that the country is grieving. And also the news was in all over the world. Even many people from different countries came here to express their sympathies, to accompany the family, the other leaders of the nation to grieve and to continue as a nation. Right? So what a nation can do, what a leader can do when these circumstances happen, well, this is what we have been observing: to lead with authenticity, to be involved with the pain, also to make decisions, because as a leader, you cannot be stuck with the pain. You allow the pain, but the nation continues, the country continues. The country cannot stop. It's not a personal grief. It's different than the grief that a leader of a nation experiences. So it's very important also to create a culture of humaneness, okay, to connect, to receive the condolences, to even receive the leaders of other countries. And also very important to take the grief as an opportunity to strengthen the country or the organization or the family. In this particular case that we are discussing, I do believe that in a way, there was an anticipated grief, that it's also a concept that is very important in psychology, in which the country, in a way, was preparing because the president was not seen for some time because he was sick. He had an impairment condition. So in a way, the country started grieving before his death, but still the pain is there, and still the country needs to grieve this situation that has occurred. So this workshop is called Coping Strategies, in order to regain, again, what we would call normality in quotations, what we will call going back to reality, going back to adaptation. So what coping strategies we can think of? And if you see, there is a question mark. I did not want to write specific or giving you advice as to what coping strategies you can use. No, because I think that would be too intellectual. That would be too professional from me giving advice to you what you should do. Instead, I would like to ask you, you can write it in the chat, what do you think are the best coping strategies that have worked for you? And I would be more than willing to read them. And then I will share with you one of my coping strategies that has worked particularly for me. And I will tell you, I'm willing to share you, because that's also helping me, my grieving process, how that helped me in order to be more aware and in order to continue with my life. So you can write in the chat what you have done, okay, when you have lost somebody. And also think now of what Elizabeth Cross has told to a group when she was receiving a prize. Now I will read the sentence. She said to a group of important researchers, she said, now you are reacting, hold on, okay, now you are reacting like human beings instead of scientists. Maybe now you will not only how a dying patient feels, because she started working with dying patients, okay? So now you will not only know how a dying patient feels, but you will also be able to treat yourself with compassion, the same compassion that you would want for yourself. So please write in the chat, what do you think are the best coping strategies that have worked for you? And then I will share with you some coping strategies that have worked for me. So let me read. Okay, let me see. Oh, somebody wrote in Arabic. I'm sorry, I don't read Arabic. So if you would mind translating for me in English, I would be more than willing to read it. Okay, let me see. Patience, not trying to reject experiencing the grief. I will start getting close to the people whom the died person associate with, seeking social support from family, friends, beautiful. Not hold the tears. Oh, that's beautiful. Not hold the tears. Beautiful. Thanks. Who's this? Arwa. Thanks, Arwa, for sharing that. Writing my feelings out. Oh, beautiful. Writing helps so much. Yeah, talking, right? I cried when I feel crying. What else? Remembering the good memories. Oh, that's beautiful. Who's this? Shaika, remember the good memories, doing charity, helping those who's in need, and being kind makes me feel better. Oh, that's a beautiful coping strategy. Composure, thank you. Praying to God. Oh, Yeah, definitely. Praying, doing rituals, religious or ethnic rituals helps a lot. Yes. And let the tears and all the hurt inside. I bought flowers, even I cannot place it in my father's grave. Oh, flowers, because flowers are a sense of growing, beauty, smell good, they bring freshness. Yes. Not setting a time limit. Oh, that's beautiful. Who's this? Amna. Thanks, Amna. Amna, so intelligent. Not setting a time limit on how long I will feel sad. You can feel sad all your life, if that's your need. I mean, nobody has to tell you how you feel when you have lost somebody. Crying when I need and praying for them. Take vacations. Oh, that's a practical aspect. Yeah, yeah. I will keep praying. Hold on, I have to read. I will keep praying for them and make them proud of me. Oh, transcendental aspect. Thank you. How we support by many ways the people who has one of his family died. Thanks for that. Let myself feel the pain and all the other emotions. Be patient. Get support from somebody. Take a break and take a long look. Okay, well, so it seems that you know more than me and you are more creative than me, and we have to acknowledge that we sometimes we forget that we have internal resources, we have resilience, that sometimes researchers, intellectuals, faculty, we get detached from those important emotions. So thanks. I told you that I will share mine, so this is mine. Hold on, let me okay, this is a picture of my mother. This is my mother when she was about 7 years. And these two are my two aunts. And the one that it has an arrow, he passed away. So this was maybe 2 or 3 months before he passed away. And this picture, my brother recovered this picture when he did a trip last year to the town where my family from Spain grew up. So he recovered this picture. And to me, when I see this picture, I still become very, very emotional, because I have always had the impression that, and I'm sorry if I get a little bit emotional, that this death in my mother's family had a very important impact. Even though we did not speak a lot about this brother that she lost, but as you know, we psychologists, we are requested to have our own personal psychotherapy. And I remember, I have shared this experience with my students. I remember one time my psychotherapist asked me, Maria, have you lost a sibling when you were young? And I say, no, never. No, that I'm aware, no. And then, the comment impressed of me, but because I haven't lost a sibling. But now when my brother recovered this picture and we both, my brother and I, realized that my mom had lost a sibling, we connected, and it has such an important value. This old picture, this picture has more than 70 years. So it's an antique, a real antique, at least in my family. And it gives me the opportunity to connect to my mother griefs, but also to my families, because sometimes grief, if we do not evaluate, if we do not work on that properly, it can come and haunt us. So maybe sharing you this picture with you, it's also a coping strategy that I can use in order to grieve from our losses. So let's come back to finish. Let's come back to our lady, G. She dreams a lot and she tries very hard to work on her dad's death. Okay, and I use this picture of Frida Kahlo, this painter, Frida Kahlo painting his dad, the picture that you could see in the right part. And these are 3 dreams, all of them related to elevators. that she has. These dreams are very recently, okay? And in the three dreams, if you can read them, you can see that she cannot get to her destination. She is missing something, missing to continue her life, because this lady she's stuck in this grieving process. She has a lot of difficulties working. Maybe we could say that hers is what we call a pathological grief, because she regrets a lot. I mean, she cannot function properly. She was on medication, but medication did not help, because we have to know that medication doesn't help in the grieving process. It helps in some of the symptoms. It allows you to sleep better. It allows you maybe to be less agitated, but the pain, that doesn't work. The pain, the only thing that you can do is to work with it, like G is doing. She's dreaming, and we discuss her dreams. If you can see in the three dreams, elevators, she gets in the elevator, but the elevator doesn't go where she wants to go, to her destiny. It's very interesting. In the third dream, she says, I'm in a tall building on the 19th floor. Her dad lives in a building in the 19th floor. So even though her dad is not directly in the dream, the symbol of her missing, you know, the sensation of her wanting to continue her life, but she's stuck for many reasons that we have. I mean, it's not today, we are not going to discuss that, because that will be another session, but you can see how this impacted her life. And well, my thanks to all of you. I'm sure the country will regain again our freedom, regain the passing of this grief, and with the union of everybody, we will continue the journey of life. So questions, comments, thanks Noof for appearing, and don't leave me alone in my grief.
No.
Thank you.
No,
Thanks a lot for your attention.
Yeah.
Sure.
Thank you so much. This is very informative. And as I mentioned earlier, it is much needed topic to speak about, because the loss that we as a society had, and it's not only a loss of Emirati people, but everyone who lives in the UAE, basically. I think I will open up the floor for people if they have questions. You're open to share your questions on chat box, or you want to unmute yourself, maybe share observation, reflection. It's up to you. Meanwhile, my team will post two links, very important links. The first one is for registration for if you're a staff member, faculty member in the UAE University, and you want us to count your training hours, please make sure that you are registered. The second link is for evaluation. We want to improve ourselves in the next sessions, what topics you want us to cover. I'm really grateful, Professor Maria, because we usually have a large number of people attending such topics, but today's topic apparently touches so many hearts. And it's hard, you know, it's hard when we talk about hard emotions. We rarely touch those topics. So yeah, the floor is open for people to ask questions. I'll be around, don't worry.
Thanks, Neil. Thanks a lot. And as I said, you know, the Happiness Center is aware that we have to live not only with happiness, but also to make contact with these more difficult emotions.
Exactly.
Yeah,
and it's part of our life journey.
Yes, yes.
Yeah.
Definitely.
So my colleague posted two links. The first, if you want to have, the students who wants to have the certificate, they have to register. The certificates will be issued only for UAEU students. For UAEU staff and faculty, once you're registered, we will send those lists to HR department, and they will count the training hours for you. Make sure you fill up the form before you leave, because once we close up the meeting, we will not be able to add anybody's name on the attendance list. Thank you, Nora. I have a question for you, Professor Maria, until people come up with theirs. Now, you've mentioned there's like stages people go through when they're grieving. I'm wondering if there's any study around the time frame they need through each phase. Is there any?
Yeah, at the beginning, that was an approach that that when Elizabeth published her first study, yeah, there was like a time frame in which the beginning, usually 6 months, it's the, in quotation, normal time frame. Also, the DSM has some diagnosis that if you were not able to recover within a period of 6 months, you will be in some time showing some pathological symptoms. And if you have more than 2 years, it would be considered something pathological in the mental health system. However, and having said that, there have been many researches that says this is wrong. There is wrong considering the time frame. One thing is that you cannot function, which is another thing, okay? For instance, if you have to go back to your job and you cannot function, then there's not, I mean, in 1 month, for instance, if you are in a vulnerable state that you can lose your job in 1 month, usually this is what we have in the companies, in the university for the grieving process. You have to come back, because if not, somebody's in the waiting line asking for your job, right? So one thing is that you regain some skills, not skills, some strategies, some coping strategies to continue your life and still grieving. But nowadays it's not appropriate. That's this is one of the important data that we have found in research, that grieving could last all your life. And it's in some way, it's okay, because that means that you are attached to that figures. In terms of the country, for instance, okay, the country needs to move on, needs to continue living. The society cannot, I mean, we can grieve, we can have all the ceremonies, we can have the acts, the commemorations are very important. When you commemorate yearly, for instance, that's also have been studied a lot. For instance, there's a very interesting study. They study women who had heart attacks, and they correlate that with the death of the partner, the death of the husband. And it was found that the heart attacks were very close to the anniversary of the death of the husband. In terms of correlation, that doesn't mean that it's the cause, but in terms of epidemiology, it's very important, because we counselors, we mental health professionals, we need to be aware that anniversaries have a very special significance in our lives. Even though an anniversary is something also created, because time, it's very subjective, right? Time is not objective completely, but the significance that we give to the anniversaries, for instance, the birthdays, according to the culture, there are some cultures that you don't celebrate birthdays, but you celebrate other holidays. For instance, here in the Muslim countries, the Eids, the birth of the prophet, for instance, these are very important dates that commemorate important celebrations in our society. So this is very important to pay attention.
Okay.
And also, for instance, when we are dealing with, we didn't speak here because that's even more difficult to speak, the death of a child. That's another topic. We don't want to overwhelm people, okay? We're in the summer, but the death of a child. Now we, for instance, that the US have a horrible tragedy. I don't know, 22 children died. So the death of a child has a special circumstances, because you can understand the death of an old person, the person who is sick, for instance, a parent that you know that someday he or she will go. But the death of a child, it's not something that in our mind is not prepared to do that. So the pain, it's more difficult. The grief, it's more difficult. And in fact, the death of a child doesn't have a name. I mean, you could be a widow, you could be an orphan, if you lose your parents, but if you lose a child, there's no word.
That's
At
true.
least in many languages. So that means that it's a very, very painful, and we have to be prepared. I mean, we can speak about that, but I have also to be prepared to prepare the workshop, because it's very painful when we speak about,
It is indeed.
yes. And in schools, they should be aware of that. There are principals, teachers, the other classmates, how to deal with that. That doesn't mean that it's not possible to go through the grief, because again, human beings, I think in our mind, we have also the structures to rely on our internal resources, on our resilience, on our positive psychology. Now that you're an expert on positive psychology, how we should also focus on, because focusing on positive emotions, it's not mean that you are going to focus on, oh, nice emotions. No, positive emotions, it's also grief, right? No, I mean, I know, you know this more than I. Yeah.
And I do hear this comment from a lot of people, even friends and family members. They're always saying, oh, you work for this happiness research center, you're happy all the time.
No.
And I hate that, you know, they have an expectation that I have to be happy. I do get angry and I do get sad. I went through a very depression phase in my life, a depressive phase in my life. And I had to deal with that, to be honest.
Yes. We have to teach them that no, positive psychology is not about being positive all the time. No, it's about using our internal resources. Yes.
100%, I agree.
Yeah. You know, Arwa says, interesting. We have a word for the mother who lost her child. Oh, that's very interesting. In Arabic, you mean?
In Arabic, yes, this is in Arabic.
Oh, maybe Arabic, it's a very intuitive language. And it's a very, I wish I could speak Arabic, because it's a very, because usually, for instance, Spanish, in English, we don't have a word. We can say a grieving person, but an orphan exists, a widow exists, okay?
Yeah.
But it's interesting that in Arabic you have that word. Maybe it will be interesting to do more research on that, the meaning of that word in the population, for instance.
The population,
yes.
Thank you so much, Arwa, for reminding us. Thank you. Very informative piece of information. And last question before we close down the session. And a reminder for all people here, don't forget to sign up, please, in the link. Professor Maria, do you think grief is also an important emotion? Does it has any benefits?
Yes. And thanks for that question. Yes, it's difficult. Sometimes it's not, I mean, you cannot control it. I mean, but it's there. It's part of being human. Every trauma, it's part of life, and it's a very existential position that you have to assume. But definitely, grief is part of life. Again, whenever we lose something, we have to mourn that. Of course, if that things that we are losing, it's important, we will be more concerned if we are attached. So any society has to grieve their fathers, their figures, their leaders. When we work in an organization, if a colleague or our supervisor, even when they are leaving, it's a grieving process. Not as much when the person is gone forever, but definitely. Yeah, here somebody asked about the pet. Yeah, even pets. Yeah, I didn't want to overwhelm you with my own stories, but you know, Sigmund Freud, the great Sigmund Freud, he was very fond of dogs. He had 2 chow chows, and even he attended his pet in those years. Now it will be impossible, right, to have a dog in the consulting room, but in those days, it was common, and he lost one of his dogs, and he wrote about that, and he said that the process, it's the same. The only difference, yes, when you are attached to a pet, I mean, and I can testify, okay, the only difference is that it lasts less, okay, But I remember when I lost my pet, I mean, I was even making laugh of myself because I said, that's not normal that I am experiencing, because I didn't talk about this, but every loss that we have, if we are very attached to that object that we lose, it triggers other losses that we have had in the past, usually losses that are related to our childhood. So it depends how we resolve those losses that we have had in our childhood. Then it will govern how we deal with grief in our adult life. Because again, one loss is trauma. If we are attached to that object, is traumatic. Okay, and trauma are not isolated from our history. We are historic human beings, and one loss can trigger many other traumas that we have had in the past. So yes, yes. So we should not feel, sometimes in my case, I also feel ashamed that I couldn't go to work the day my dog passed away. And because he was with us for 17 years. So he was part of the family. I mean, he was another person, another figure. And that day I remember I couldn't go to work. That day I said, I'm sorry, I cannot. The day after, then I regained my control and I continue living.
Yeah, it takes time to deal with it. Yeah.
Yes, yes, yes.
Well, I'm guessing nobody have any questions so far, and we will be ending the session. Dr. Maria, thank you so much from the bottom of our hearts to you, and for giving this as an important session. I thank everyone who attended today's session, and I really hope that you share your feedback with us and let us know what other topics you want us to cover. Thank you, everyone, and I hope all of you stay safe.
Sure. Thanks to all of you, and especially you and your center, your team also. Thanks a lot.
Yes. Thank you so much.
Sure.